Hello, I'm here with Michel Perreault from Aceso, Director of Product and Digital Signage. We're here to talk about a case study using Signagelive and with Aceso delivering the solution. Do you want to kind of open up as who the customer is?
Yeah, it was for Baptist Healthcare in Pensacola, Florida. They installed a new hospital and medical office building. So it was a brand new installation. The old hospital had been around for a long time, and they wanted to provide some true technological innovation into this facility. So Aceso provides technology for the in-room patient, bringing in disparate systems like ADT and EHS, electronic medical records, into the patient room so that the patient can look on the television and see all this stuff.
What do they come to you with and say like, oh, we're really struggling with this, or this is the impetus to start looking at things?
They wanted to, they're a very community-oriented hospital, and they wanted to show that they are on the leading edge of technology. So that's why they brought us in for the in-room. But outside the room, waiting rooms and lobbies, they also wanted to put in traditional signage, and they knew that we did that.
Right. Okay.
So they brought us in to do traditional signage. We ended up putting in like 35 screens in all different kinds of use cases.
Right.
The cafeteria has 11 screens in it that's managed by a totally separate group, which Signagelive has a way to segment the users so that they don't see anybody else.
Right.
Okay,
so you're like different levels of access for different people based on what they're controlling.
Exactly. There was a foundation group that wanted to have some exposure to their foundation and the donors. There was the marketing and communications group that wanted to have screens in waiting rooms and some of the conference centers. And then there was another group that had just the physicians itself, the staff physician lounge.
Right.
Okay, and there was a separate group. So it provided a use case, and also directories.
Right.
Automated directories, which is a big thing for hospitals right now.
Yeah,
they're all getting rid of the posters and the paper. Right?
Yeah.
And they're going electronic. So it provided a lot of different use cases, which Signagelive is able, through their technology, the functionality enables us to provide a solution for all of their use cases. Like you said, they wanted to be technical and show a leading edge approach to the community.
Yeah.
So that's what, and we're going to talk about the foundation donor wall.
So it's about connecting with the people, different levels, different groups, trying to communicate to whoever it is that they're most responsible for.
Yeah, there was
connecting with.
Yeah, exactly. It ended up being 4 different user groups with all in this distinct use cases for their screens.
Very cool. So they're all using it slightly differently, as you say, like through whatever it is they're trying to deliver. As you said, like whether it's cafeteria, canteen information, or whether it's something else. It's just about making it specific to their experience.
Exactly.
Exactly. So we're talking about the donor wall. What's that about?
Yeah. So that's what's interesting about this particular project, because we are traditional signage for hospitals and healthcare facilities.
Yeah. And that's your core focus.
That's our core focus, right? Well, we found out late in the project that the hospital was working with a technology company, consultants, the architect, and a company called Nanolumens that makes LED video walls. They wanted to do something that was going to really stand out and be unique.
Yeah.
So they put together a plan to create an accordion fold digital LED.
Very cool. I've seen some pictures of it. Yeah, very impressive.
Yeah, it was 26 feet long by 6.5 feet high.
Wow.
It has 14 different panels that alternate in different directions.
Yeah, so depending on the angle you're walking at, you see a different story.
So in the concourse, if you're walking down the north side, you're only going to see one image down that. Going in the other direction, you're going to see a totally separate image.
Yeah, very cool.
So that was pretty cool. The challenge for that was originally they were just going to have a screen, one video port that provides an image to the entire screen.
Yeah.
They pulled me into the project at the last minute and said, oh, we totally didn't think about the CMS, or how is the content going to get delivered to
how are you going to get that done?
Right?
How do we turn these screens on with something?
Yeah, and the deeper I got into it, the more I realized that they wanted to have 2 separate groups manage this wall.
Oh, really?
Each group would be responsible for their direction.
Oh,
Okay,
fascinating.
so the foundation was responsible for the south-facing screens.
Right.
The marketing
very
department
interesting.
was responsible for the north-facing screens.
Huh.
And neither would they interfere with each other. So that created a technical challenge. We worked with nanolumens to remap the wall
Yeah.
so that every other panel would start at a different XY coordinate.
So they're kind of like one. Every other one is concertinaing into one device that's managing
Yes.
the content
Yeah.
control.
Yeah. So this of course helps the content creator not have to split up the content into 14 different segments.
Yeah. So when they're uploading a file, it's one file.
It's one file, and that's where Signagelive came in really as a great solution, because with your layout template, you can create 2 separate playlists, and we had nanolumens map just that one playlist resolution, which ended up being like 2200 by 660.
Right.
660. The content creator only had to create one image, and the nanolumens DIU would split the content.
That's very clever.
To the Novastar controller, which sent it out to the wall.
So anyone using that content, I mean video or images or whatever, they're just dropping in a file of the specific size, and the rest is just done automatically. That's very, very cool.
Made it very easy. We ended up submitting that as an entry into the DSE award competition last year, and we were chosen as a top 5 finalist for the healthcare category.
It's fantastic. So that's very, very cool. So what was the end result in terms of what's their feedback been from the experience?
So the feedback I got from the hospital was that, number one, they wanted to provide exposure to the community for donors and contributors to the hospital. Okay. What they found was that they were getting calls from others to want to donate because they wanted to see their name on the wall.
Yeah.
So
you're gamifying it to an extent.
Exactly. Yeah. They got a lot of exposure by having that wall and built up their donor recognition.
Very cool. So for anyone that's looking at approaching this themselves, especially if they're in the healthcare sector or they're kind of looking at doing something of a similar style, what would your advice be to them as kind of a first step?
First step is understanding what the use case is.
Right.
Had we known way in the beginning that they wanted to have 2 separate user groups managing the wall and how it would be laid out, then that would have saved us from having to go back to the manufacturers to have to remap the wall in this particular case.
So you're delivering
is critical.
You're delivering everything for them in that case. You're delivering the installation, obviously sourcing all the hardware and the software, getting everything configured in that sense.
For the donor wall, for that particular wall, we came in late. They had already decided all that before understanding.
But for the other digital screens,
but for all the other screens,
all the other ones around that,
we were pulled in. This is what we're going to do. I was able to set up local users for the cafeteria.
Great.
That group. That has nothing to do with the hospital. And even for the physician lounge, that was a totally separate group, managed by different people. They only need to see that one screen.
Sure. Yeah, of course. Yeah, I really appreciate your time. Thank you so much.
Thank you.
Thank you.